Dear friends, it is the 25th of November 2017, and I want to talk to you about the policies that should apply towards the issue of health. So, like with every other policy, the first question that we need to ask is whether there is any role for the government in our health. Without addressing this question properly, we will fail to arrive at a sensible policy, as has been the case with many socialist societies, and we know that with the case of India, where there is no understanding of why the government should have a role, but there is a role nevertheless. So in a free society, everybody must take responsibility for their health. The moment this principle is violated and someone else is expected to become responsible for our own health, then I think everything gets distorted and the society itself can end up in great trouble. It is quite reasonable to expect all of us, what able-bodied persons, to visualize the natural course of life and to plan for our health outcomes through appropriate preventative care and health insurance. So we look after our own health as much as possible, and we also take a health insurance in case something goes wrong which is unexpected. And in the midst we have a thing called the family. A family is expected because we provide support to the family. Likewise, the family provides us support when necessary. So by ensuring that medical costs are met from people's own savings or insurance or family care, the whole system remains well integrated with incentives. There is no incentive to cheat or to become unnecessarily unhealthy, because then people are becoming unhealthy because they expect the state to look after them. That's happening in the West. So we want to have a system where people take responsibility and there is a closed loop in this regard. So at least as far as the rich are concerned, we all should agree without any problem that the government has no role in the health of the rich. And as far as the upper middle class and middle class are concerned, they can surely take care of their own health and they can insure for it. And with that, we sort of finish up the vast bulk of society. And yet there is a very genuine argument involved in this case, like with everything else in relation to social insurance for the very poor. So there is when health goes bad, the poor person who already has no insurance, no capacity to insure, the person's future becomes bleak, and he or she can do practically nothing. So this is where I guess we are saying that there is a role for social insurance, and it's also not necessary that somebody is permanently poor. Somebody might become poor suddenly, from middle class they might slip to the poverty status, and in that case again there is nobody to look after them, and they become helpless if their health is affected. So this is really the targeted case for involvement of society in somebody's health. What we need to make sure is that this particular person is actually genuinely poor, and I'll come to that in a minute. And we also have cases, by the way, in addition to the poor, where somebody might be involved in an accident, a traffic accident for example. It's not possible to assess the person's ability to pay under such circumstances. This kind of a person has to be restored to some sort of normalcy before anything can be discussed regarding the payments. This again is part of social insurance. And similarly, there are things like vaccines and other matters that affect the whole society where there is a role for government, and I'll come to that. But basically what we see here, that this role is nothing to do with the universal role that many people believe the government should be involved with. So in many of the Western societies, there has been a degradation of the concept of healthcare, and people have asked the government to get involved. and that is an extremely inefficient way of managing health. The rich don't want to use the government facilities. They will still use private facilities. And so we have duplication, we have distorted incentives, and we have middle class being charged excessively for what they would otherwise have got very cheaply in the market on their own. So regardless of anything else, one thing is very clear. We could not through this argument identify any role for government to directly manage anything in the field of health, such as hospitals or primary health centers. We have to look after the poor. We agree on that, but that doesn't tell us that the government has to directly manage a hospital. Okay, so that's the basic point here, which sort of tells us how Indian system has been so badly distorted over the many 70 years after independence. Now, for the poorest of the poor, those who can't afford basic care or elective surgery, there is clearly a role for government, and we need to be aware that at all times that there has to be prevention of any cheating, a moral hazard. This is a very dangerous situation where you start putting big money on somebody else and using taxpayers' money. There's a strong incentive to cheat. You need to be very careful when you start doing such things. The sensible solution is, and this is this one party solution, for the government to pay the insurance premium for the basic health care and elective surgery of the very poor. And these are the people who are otherwise eligible for the negative income tax funding that I have been talking about in many places. Now remember, not everybody is desperately poor, so depending on the level of poverty, we would expect some of the deductibles to reflect the ability of the people to pay. And being a large purchaser, the government should be able to negotiate and bargain with the market to get very competitive rates for this kind of insurance. And this will be extraordinarily cheaper than the government managing the whole health system on its own, and it'll also be effective. Now I've already mentioned, sorry, I'm having a bit of a throat problem and hay fever and so on, but I just need to continue and complete this today. So we talked about the moral hazard issue, and we don't want the poor to start expecting the government to take care of their health. Now we know that excessive smoking and drinking can cause significant health issues, and these are the various bad habits, different kinds of bad habits, including gutka, and pan, etc. So these kind of things we need to exclude from these kind of insurance premiums. That is, if the poor don't take care of their own health, then we're not going to look after them. Okay, there's no obligation that you don't take care of yourself, and yet so somehow the society should look after you. So I think this is essential. More work needs to be done in the detailed design of this particular exercise, that the incentives are not distorted. That was for the poor. Now let's look at the the people, the universal insurance for trauma. And by trauma, I mean genuine emergencies, not something like a planned elective surgery, but something that happens unexpectedly and it is quite significant, heart attack or traffic accident. Now, when this happens, it is not necessarily possible, not practical in all cases, to identify who the person is, what their ability to pay is, and so on. What we need, however, is to protect the lives of these people. So the universal health insurance model for this purpose would actually require the government to back up, to sort of assure hospitals that it will pay for all necessary care to bring these people back to normalcy of some sort, and such that they can stand on their own feet. So that they, things like trauma care and bringing them back to a condition where they can then be looked after and brought back to normalcy of some sort. So this is important, that we are talking about extreme rare cases. And in this particular case, there needs to be a system by which the government pays the hospitals for the care, but thereafter the government then charges people based on their ability to pay. So if somebody was already insured, then when the government would get the money back from the insurance company in due course, and so on. So what this does is it brings a kind of humane consideration for society as far as traumatic events are concerned. Now, this thing also has not to be provided by the government. Under no circumstances should anything be provided by the government in this field. The hospitals are really competent. They are able to do these things. All we need is to have a mechanism and competitive tendering for such care. One of the models I have in mind is that the country should be carved into reasonably sized regions and put out for tender for about 30 years for different types of trauma. And then what happens here is the hospital, the nearest hospital, the person affected can go to the nearest hospital. The hospital will look after the person and bill the government, in this case, for an agreed amount for which they have already been successful in the tender. So the entire region, this consortium will cover the entire region. All hospitals will agree to a particular formula for paying for a particular trauma. And this is important in case of, say, Northeast, which has got very few hospitals and long distances and difficult conditions. So in those cases, we would expect there would be a higher payment for looking after trauma than in a place like Delhi, for example, where there's much more infrastructure and a lot of doctors and hospitals. So either way, this is a long-term contract we're talking about, but this is one of the models, and I'm not saying this is the only model, but this is one of the more likely models that will succeed in solving this problem of incentives, so that people can go to any hospital when they're injured, and that the hospital will take care of them because they're assured of a reasonable amount of reimbursement. Now, because of competition in the tendering process, this will be a relatively low cost, but because it's also a fixed amount and it's not based on a free for all, like a fee for service kind of concept. So it's if somebody's got a traffic accident, you have a fixed amount. The hospital has to take care within the fixed amount, and that means the hospital have to become more efficient or cross-subsidize from different kinds of treatments to ensure that whereas a serious case, they put some more effort and become more efficient. So we're talking about incentive compatibility design, and I'm not here wedded to this particular design. I'm sort of illustrating this as one possible model, but this model is something that I think can easily work, something on their lines. And either way, the the net result is that the poor people will be actually looked after by the government, and the rich will have to then pay back to the government. The situation here is that when somebody is in a traumatic condition, they will be looked after. And this also applies to foreign citizens, people, these foreigners who are on tourists or whatever, they get affected by some traumatic event. And they basically have to, get cured. And at that point, when they are recovering, then there has to be noting in the passport that they are allowed to leave the country after having assured the payment. So many of them have health insurance, and otherwise they have to organize funds from their country to pay for the costs. I mean, if something goes wrong unexpectedly, it can go wrong anywhere. The individual must be held to account. We are not responsible for foreign citizens' costs. Similarly, the other the implication of this whole exercise is that we have to privatize like I was talking in the case of school education, to get rid of our government control of any of these private health centers and hospitals. They are mostly dysfunctional. I have been a additional secretary health in Assam. I've never seen more dysfunctional systems in the world anywhere else. Completely corrupt, completely improper, unsuitable. Nobody should possibly would possibly want to go to a government hospital or a primary health center in India. So badly they're maintained and looked after. And it's not about the funding, it's about the very design and incentives. So we don't need them. What we need is to have the private insurance models. These models, because it'll be in the interest of the private insurer that people are looked after early in terms of their any defects, or what you call health issues they may have. These private companies will have the incentive to create necessary treatment options for the people who are poor. I'm not going to speculate on what kind of options the private sector will create, but I can assure you they'll be far superior to the primary health centers and the government hospitals. We need to simply get rid of our obsession that government has to manage healthcare. Government has to assure healthcare for the poor, but it has no business to directly manage anything, particularly healthcare. And then there are things like universal health programs. We would need the government to play a role in things like vaccination for infectious disease. We need to support public education in public health, sanitation, nutrition, tuberculosis, etc., hypertension, drug abuse, and so on, and many other such things. And so there is a role for government in education and in some sort of way to support matters that affect the whole community. And I've discussed that at length in the Swarn Bharat Party manifesto. In addition, in the manifesto, there are a good number of examples of how the details of this health system will work, including things like drug, treatment for how we would deal with drugs, for example, how we would deal with alcohol, and many other such issues have been discussed in the manifesto. I think this is sufficient for now to provide a kind of outline of the general principles that should drive health policy, and they are very similar to the ones that should drive education policy. Basically, people need to take care of themselves. The government has a role for the very poor. That role has to be very carefully crafted. I think with that I will leave it here for now, and hope if any questions that I can address them in the future. So that's about it. Please share this if you find this sensible, because I think the Indian system is completely chaotic and dysfunctional. This is the only sensible way forward. So now I've outlined the health system for the country. Please go ahead and join this One Bharat Party, and let's get it implemented. Thank you.